Hi everyone. Today I want to talk about something that is termed as medical gaslighting in some American videos I saw recently in a website called The Patient Story. And I completely empathize with the stories of some women there whose videos I watched who were talking about how some of their cancer diagnosis took a couple of years or a couple of months to finally get diagnosed because they had to go through a bunch of loopholes in the healthcare systems that they approached for their health. And apart from medical gaslighting, I also saw some recent video clips where a doctor in US who is an anesthesiologist has got comments from women who have felt the discrimination of certain things in common in healthcare systems, where women can sometimes get also discrimination based on the prescription they are given for their disease or condition. So there were women who listed that if after having ruptured uterus and other pregnancy related complications, their doctors had only prescribed them either an NSAID like ibuprofen or some very minimal pain med for a few days, or whereas their spouses, when they had very minor surgeries, much less painful surgeries like a vasectomy, they got prescribed some heavier pain medications. Now, again, with those women too, I empathize a lot because I faced something very similar, not in US healthcare, but the same trajectory happened to me related to medical gaslighting and medication prescribing when I was in India. But currently I live in India. Though I have practiced as a pharmacist in US, I've also studied healthcare administration and business administration, and have worked in a hospital. So I understand a little bit about the hospital workflow. As a patient also in US, I have observed how it occurs for patients when we are approaching a doctor from the patient perspective. And I did some studies related to that. As a result, I want to discuss on these topics. So let's address the medical gaslighting part, because here to heal this problem, both from the patient perspective and the provider healthcare perspective of any hospital or any hospital system that deals with a patient, we have to first understand that there are many things that need to shift within the mindset of the patient as well as the mindset of not just the patient but also the mindset of the normal standard approaches that a hospital or a healthcare setting or a group of doctors take when they see a patient. Now, the reason why I empathize with all the medical gaslighting patients is because it happened with me as well. Because what happened to me, before I got into a very severe cancer-like stages of my health, some of my doctor's reports showed that I was going towards cancer, or I have these benign conditions that have a propensity to go into cancer eventually. And some of these health problems were detected when I lived in US about 10 years back, or more than 10 years back, when, for example, I had a follicular nodule here in near my thyroid glands, which, if you want to just imagine how it looks like, it's like a pimple like growth which has happened in near my thyroid gland, but it's internal instead of an external pimple. And if in when we have a pimple which is outside on our skin, after a few days the pimple can naturally burst out and release the pus, or if it doesn't naturally burst out, sometimes we apply medications to it, it can even burst out at that time. Or sometimes if people didn't go to a doctor, didn't take a medicine, but they were scratching their face or something, they can lead to the pimple getting burst. So there are these three conditions that can cause a pimple, which was round, swollen structure on my skin, to rupture out and remove all the pussy and gunky stuff that had accumulated in a pimple. And that's why the pimple is unhealthy. Same way, a follicular nodule that I had in my near my thyroid gland, it has now couple of different things that can possibly happen to it, because it's something that is internally growing, unlike a pimple on my skin, or even sometimes in pimples also, case of pimple, we have the tendency that instead of having just one pimple, suddenly 3-4 pimples will grow on our face. Like that same way, when I initially this nodules got detected for me, I had 3, 4, 5 nodules, but they wanted to keep monitoring it because these nodules can convert from a benign stage into a cancerous stage. When it converts into cancerous stage, it will either have abnormal shapes and sizes, or it will grow into large numbers, or it will grow into a larger size. So a small 1 millimeter size nodule can grow into a 5 millimeter size nodule in a span of few years or decades. And when it grows into a larger thing, then it can become cancerous if the large growth is rupturing and disrupting my normal body functions in some ways. So that's why I was told by the US doctors that every few years I should get a ultrasound done to see whether these have grown in size. And one time I was also recommended to do a FNAC, which is where they extract the contents of this pimple-like structure and take out whatever is there in the pus-like thing inside my pimple. When it ruptures, it comes out. Like that, if we pierce a needle inside this nodule, we can also extract the inner cell contents, which are possibly like pus-like things, and that inner cell content of that nodule will determine, is it cancerous or is it just a normal gunky thing inside my body which will heal by itself. If it is not cancerous, it will be called as benign. But if it is growing in an abnormal rate than normal, and it is showing some structural deformities or other cancer-like tendencies, then which, because I'm not a pathologist, I do know some pathology terms, so I'm not able to describe it as well as a pathologist would. But if it had some different pathological evidences, the pathologist will consider this as a cancer. Now with me, what happened? There was almost a 10 to 14 years gap when I moved from US and didn't follow up anything related to my thyroid nodule. I had a lot of life problems going on, and I'm also not like a very hypochondriac oriented person. So while I take care of my health, I eat good food as I can get, or I try to be healthy. I'm not the healthiest person in the world, but I try to eat healthy food. I was also trying to balance my health by because of certain things that were happening, I didn't in my personal life, I didn't want to add to the stress of looking for a job for a few years. So I didn't look for a job. I had enough savings from my US life, while if I had lived in US, I wouldn't have been able to use that money effectively while living in US. That same small amount of money that I had there in my savings in my US bank account, I could use in India, as the same money goes a long way in India. So for a few years I didn't work. Few years I was more focused on healing my emotional health and working on my emotional health, working on balancing myself, doing just eating food and just living a cheerful life like a carefree person, not thinking of financial responsibilities or professional work related to a pharmacist. Because I had worked as a pharmacist, and I had also studied healthcare administration for a future direction of other kinds of healthcare related work. So everything I had studied in US, I had lived in US for 13 years, I completely put it in the back burner. And what was I doing? I was just trying to meditate. I was trying to do art therapy. I was trying to hang out with my family more, because when you live in US, you don't get to see your family as often. So while from US, I would come only once in a couple of years to visit my family. Now I would go on vacations a couple of times in a year with them. I would go and I had the luxury of going and staying with them for over a month, whereas when I would come from US, I would only stay with them for 5 or 10 days. So I was taking the mental healthcare perspective of relaxing and resting, because my body had become a little stressed out from living in US. There were many personal life related factors that were influencing this stress that had developed in my body. I was called something, I now realize I went through something called burnout fatigue. And as a result of burnout fatigue, I wanted to reconnect back to my roots. But I was not simply reconnecting with my family, because my family, once you move from a Asian country and live in a more developed country than an Asian country, our mindset and approach to life can change a little, which can lead to conflicts with people who are of a different mindset, and as a result of which they do not move from their own country, right? So the different mindset that is needed, like say if independence is needed, if self-assurance is needed, if confidence is needed in the work that you do, all these are appreciated by US lifestyle, appreciated in US healthcare, appreciated by people in US. That's why I was qualified to work there. But these are also the same conditions. Being a woman, they do not accept that about a woman in certain patriarchal societies in India, because they expect that the woman should be meek, women should be mild, women should be not as self-assured like a man, women should be more docile or submissive. But I'm not that personality. So I had some conflicts going on in personal life as a result of this personality difference. It wasn't like a major conflict, but it wasn't a very happy circumstance, and it added to my plate of already some unhappy things going on in my life. That's why I was focusing more on personal health. I even worked for a US company from India for a year, who were trying to do some research work related to natural plant medicines. And I gravitated towards self-care using natural plant products, not natural plant products itself, like the medicines that this company was trying to sell to patients, but I was naturally using more nutrition-based approach and home remedies to balance my health as well. Some of these home remedies were based on Ayurvedic principles, some were based on allopathic nutritional care, right? So I was doing all these approaches to balance my health, align my health back, get well from the emotional and physical levels, where I don't need to depend too much on medicine. Because being a pharmacist in US, I've worked there in the retail industry for 7 years, and 6 of those years were as a pharmacist. And being a pharmacist there, I observed the medication dependency that people have in US. Not just medication dependency, but I also observed certain patient population that would gravitate more to our pharmacy, who were either elderly patients or women who were depressed, women and men who were depressed or having some mental health, emotional health issues, or people who were either buying a lot of prescription pain medications. And some of these patient groups now were patients who were getting slowly drug dependent on their medications over time of use. So there would be patients who are if in their 50s and 60s, who when I joined the pharmacy, if their prescription had only 30 pills of a pain medication that they would take occasionally for their pain, or they're buying it for their spouse and their spouse takes it occasionally 1 pill a day for their pain. Now, over the span of these 5-6 years, these same patients are becoming drug dependent on a addictive pain medication, because there are many pain medications that are prescribed in US that have the potential to develop drug addiction in a patient. And while most of us think that drug addiction is something that is a person suddenly taking hundreds of pills of a particular medication, and that is very true. When someone is undergoing a drug overdose, either from deliberate drug overdose or because it has developed in their body over time, both of these drug overdoses can cause someone to take a lot of pills in one day. But how does this lot of pill taking develop in a person? The same patient who was taking only 30 pills a month, that means 1 pill a day approximately for their pain, now over time of this use of this drug, now is buying 120 pills a day. So instead of taking 1 pill a day, their doctor, whenever they're going to a doctor and complaining that, you know, my pain is not getting resolved by this medication anymore, I am feeling more and more pain in my body. Say they have a back issue and they are feeling a lot of pain for their back health. So what is happening? The doctor, now initially when he was giving them take 1 pill a day, after a year maybe the doctor is now saying take 2 pills a day because the pain is not getting relieved. The patient starts taking 2 pills a day. Now after 2 pills a day, then also the pain is not getting relieved. Then the doctor suggests takes 3 pills a day. So like that, slowly in a span of 1 year span or 5-6 months gap, the same patient who was taking 1 pill a day could be taking now over a few years later, taking 4 times that same pill that they were taking earlier. Or their dose would be increased, and instead of taking 4 times the same medication, if it is a medication which was 30 milligrams, now they are taking 60 milligrams of the medication. And also taking after a few years, instead of 60 milligrams, which is double the dose now, but also double the amount they might be taking. That also happens. So whatever is happening, either the dose has increased or the strength of the medication has increased or the number of times the patient is taking that medication increases, and slowly the patient also doesn't realize it, and if the doctor is not mindful, the doctor is also not realizing that something called drug dependency and drug resistance is developing in the body. Drug resistance means the same thing, like if I am applying, say for a pimple, if when you have one pimple, you're applying say this small dot of a anti-pimple related cream that your doctor has prescribed that will prevent this pimple from growing, or it will kill the bacteria here. Something is there in the drug that the doctor is giving that if you apply to the pimple is supposed to clear away slowly over time, because if it is a bacterial infection, an antibiotic will help. If it is a functional thing that can be dissolved using acid, some acidic medication like salicylic acid would be given to you to apply to your pimple. But say initially if for 1 or 2 pimples a little bit a dot of that drug was beneficial for me, over time if many factors are impacting my health, that same dot will not continue to work. And say I'm getting now more pimples, what will a doctor do? A doctor will either increase the dose of that medicine that you were applying, tell you to apply a little bit more of that medicine, or the doctor will give you 2-3 different medicines to apply for that pimple. Same way with pain. If you have pain, either the dose will be increased, strength will be increased. Sometimes there are also patients who will get 2-3 different pain medications to be tried at the same time. But what has started happening as a result of all this in a patient's body is the number of receptors where these pain medications can act in our body are limited in number. Say I have, for an example purpose, 10 receptors in my body where this pain medication is supposed to act. I have back pain, or say I have neck pain, I'm taking a medicine whose purpose is that it should relieve my neck pain. But does a medicine, unless you're applying it to the area where you have the pain, just work in this area? No. A medicine, when I'm taking it orally, first it has to be absorbed by my stomach. After it has got absorbed by my stomach, it has to be, when it has got absorbed, it is entering my bloodstream. After it enters my bloodstream, my blood flow has to be good in my body for that medication to go and penetrate all the different cells of my body. That's why the same pain medication can be given to someone for a shoulder pain. Also the same pain medication can be given to someone for a back pain. Also the same pain medication can be given to someone for their leg pain. Why? Because the same medicine is supposed to go and penetrate all different cells of my body, all different areas of my body, as my heart pumps the blood that has the absorbed medication in it. Now, while it is getting absorbed in different parts of the body, there are different receptors in the body with which the medicine has to attach to, and in order to interact with that area and cause relief of pain. That is some principle of certain pain medications. But if say I have 10 receptors, that is a random number, that is not the true case because everyone's body is different, but say I have 10 receptors in my neck area where this drug molecule has to go and attach to these receptors, bind to these receptors, they have to stay in this area and then give the pain relief. But if a patient's body's receptors, all these receptors are already blocked by the medicines they are taking, because every drug that I take, if I am consuming one pill, that pill doesn't always stay in our, doesn't just simply sit on a receptor. Some of say 30 milligrams of a drug has been consumed. Out of that 30 milligrams of the drug, a percentage of it will be eliminated by my liver and intestine, and it will just get removed from my body. Some of it will be converted into a different chemical in my body, which is called metabolism of the drug, and this different chemical will then go and bind to these receptors. Some of the original chemical also will go and bind to these receptors. So there are so many chemical variations of the same drug that are existing in my body, and not every molecule of the medicine that I have taken is going to leave my body. So some of the molecules are supposed to sit in this receptor for a while and then get cleared by my body and get removed from my body. But every day if I am taking the same pill, what is happening? In the same receptor now, it has space only to fit one molecule of drug. But every day if I take, even instead of 30 milligrams, now I'm taking 60 milligrams, the number of receptors haven't changed in my body. My body doesn't change the receptors. So the drug is already bound to it, but it is not acting anymore. Even if I increase the dose of the drug and keep on piling extra drug on these receptors, their mechanism of action can't change, because the molecules that I have taken previous to my initial dose, whatever I have been taking for 10 years, many of those molecules are still there in my body. And this is how drug dependency is developing, but people don't understand, because your body's receptors are already blocked. The receptors can't do any more function than when a medicine has stuck to it. That's why sometimes pain patients are given different medicine. Like if you were taking morphine, now along with morphine they will give you hydrocodone, or if you were taking hydrocodone, now they will give morphine. Like that 2-3 different, or they will give you tramadol. Like that 2-3 different pain medications are given in the hopes that they will work on a different receptor, or in the hopes that doctors are thinking that because this pain medicine is not working, patients are thinking this medicine is not working, let's just keep increasing the dose. But if your receptors are already blocked, already in such a way that it is not, there is no other way for the drug to interact with your body in this area, all the receptors are already occupied by a drug, then what is going to happen to the extra drug that you're keeping on taking? Because the drug is getting distributed to rest of my body, that same medicine